Welcome to the Step Up podcast. The name of today's episode is the After the Amputation, What No One Tells You About Healing, Hope, and What's Next. I'm Scott Baronik, Certified Prosthetist, and I'm here today with Nate Capa, Certified Prosthetist from Bremer Prosthetics.
Like Scott said, today we're here to talk about kind of what the experience is like immediately following an amputation. And I mean, we might even talk a little bit about like what that looks like, when you find out you're going to have an amputation. I think that's probably the right place to start is, you're in the surgeon's office and all of a sudden you hear these words that, I'm sorry, but the cure for what is going on for you is going to be the loss of a limb.
Yeah.
And I mean, that's really where kind of things start for this whole shock. And I mean,
I can't believe this is happening to me.
It's not even a thing I can imagine personally.
I mean,
I know you've been through the experience, and so maybe, I mean, you're probably a lot more adapted to speak on it, but I couldn't even imagine.
I mean, it's the type of thing that we hear that happens, and when it's actually happening to you, it's hard to take in. And you and I, something we talk about, it happens to less than 1% of the people in the country. So it's just, to be in that small percent,
right?
It's hard to wrap your mind around it, and it's usually happening in such a small time frame. I mean, if you have a wound, the doctor's been telling you for a long time, we've got to get this wound healed or this, but when the actual time that it's happening and they say we're looking at this surgery and now it's going to be tomorrow,
right?
It's hard. We do a lot of consultations with people. And just yesterday, I had to talk to somebody, and it's hard for them to process that this is actually happening now.
Right.
So,
and obviously, I mean, we know that this is a real life-changing event. So, I mean, without minimizing, just the impact that the decision is going to have on someone's life, I mean, we also know that fear is rooted in lack of education, right? I mean, fear comes from the unknown. The more we know about something, the more that we can put ourselves in a mindset of like, okay, there are tools. And it doesn't, like I said, no way am I trying to minimize this.
No.
But I mean, what my goal would be today is to kind of speak to someone who may be facing this and maybe start to give them that information that even though it's not going to change their mind, change their feelings right now, it's going to start putting thoughts and ideas in their head about recovery.
Yeah.
About not the process of the loss, which needs to be processed, which needs to be gone through, but okay, once that's gone through, now I can help to build myself back, right? I
think what's important though to understand, like for family members and everyone else about that fear, is there's some things in life, this is a fork in the road, this is a life-changing event. Like no matter how, like I always tell people, like if you're gonna have a disability, and you're going to have a below the knee amputation, this is probably one of the better ones to have, because we can get your recovery to where most likely you can function at the level that you were functioning at before, but things aren't going to be the same.
Right.
You're not
right.
Yeah, but so to your point, like, we want to give hope, optimism, those types of things, but it's like it is scary because it's
right.
It's changed.
Right.
Life's going to change, and that's why it is so scary.
I mean, there is an emotional and physical weight that's there, and I mean, I think it's important for people to let themselves go through, whether you call it a grieving process or a healing process or those things. The more it's like anything that happens, trauma, anything, the more we bottle that up, the more that it's just the boogeyman in the closet that's gonna be there at some point.
It's so different for everyone how we handle it too, and I think. I guess if we're going to get into that a little bit too, I know like with family members and stuff, they always like try to tell us how we should be going through that. And I think it is different for everyone.
Right.
And, it's hard for the person going through it too. It's like, they don't really realize what they're going through because they're kind of in that survival mode.
Right.
And you and I have talked about that 2-year process. You kind of don't really realize until you're on the other side of it that you're like, wow, you don't really start to psychologically process what you went through until you come out the other side. And then you're like, wow, I just went through something.
Right.
So,
and I mean, I think to go back to those family members and that support system, because we know how important those things are, right? I mean, having that support system and people that you can trust and that are there for you is a big way to get through things. But for those people, I mean, I guess my advice typically is how I face a lot of these kinds of situations. And it's like, when you want to help somebody, it's really important to ask that person, how can I help you? You know, often that help can be perceived as the wrong thing. You know, is where you're doing it out of genuine care, out of genuine love. But if it's not what that person thinks they need at that moment, it can be really frustrating. Right. And I mean, it can almost really push the wrong direction and cause some friction, cause some disconnect. So that's the thing that I've kind of learned is, you know, whether it's, you know, you're out and about and see somebody struggling putting their groceries in their car. Well, that person may know exactly what they're doing. They might be doing it the easiest way that they know how to do it. And it looks like a struggle to us. So us going and helping them could be interrupting their process, right? So I mean, if we can apply that same thing of saying, it looks like you're in a position where you could use some help. Is there a way I could help you? And if they say no, not right now, say thank you, have a nice day. And I mean, as a caregiver, as somebody who loves someone who's going through a process, I know it's a little more difficult, but that's the advice I try to give to that support is that.
And it's kind of hard to help someone too when like they're kind of going through that shock and they don't really know what they want yet either. So sometimes just like we always talk to family members, and like with Step Up and stuff, we say it's for family members as well as the patients who are going through that, just kind of listening, helping to gather information, that type of thing in the early stages.
Right.
So that we can kind of help reassure them. You know, maybe they can be overwhelmed with things while they're trying to take everything in. So like, okay, this is what so-and-so said, and kind of listen, take everything in, and, you know, do what you can do, but try not to do too much.
Right. Exactly. So, I mean, I guess the real goal for today is going to be to clear up confusion about that immediate post-operative process, right? Like, what does a timeline look like? When can I expect to have a shrinker? When can I expect to start walking again? And just to kind of share some expectations, share some baseline things, and obviously knowing that it's a process that's different for everyone, right? But I mean, have some ideas about, you know, what to expect following that amputation. Yeah. So, you know, right after a surgery, and I mean, we're going to hope that this person found out that this is going to happen, that this amputation's happening, but that's not always the case. Sometimes, like you said, it's that one day, then the next day is an amputation. If they know in advance, we hope that they got to meet a prosthetist, meet somebody who's using a prosthesis, start to learn a little bit about this process before they even go through the loss of a limb.
Right. And that's not always the case. Right. Depending, you know, it could be trauma. Maybe it was an accident, and they're there. Depending on the hospital system, whatever that is. But if there's a lot of times too, we see maybe they go to the hospital, they've had a wound, they leave the hospital, they go home, they haven't talked to a prosthetist or anything. Right. I guess, you know, there's online information. There's a lot of misinformation. Right. Unfortunately, that's just right. So I guess the thing is, where do we start to get the right information? Right. Exactly. And so, I mean, that is through, to me, you know, you have your team for your caregivers, right? I mean, there's the surgical team. Yep. There's the rehab team of physical therapists, occupational therapists, social workers, and then there's your prosthetists. Yes. Right. And I mean, these are the people that, you know, we hope are consistently working together. Yes. And are one cohesive unit together to be speaking with one voice, you know, kind of setting the same stage of expectations, kind of doing all those things so that you really know what to expect, can have can start to develop a level of confidence that, okay, this is a long process, this is a hard process, but it's doable. I got to meet this person who 2 years ago was, you know, in this same position. And when they walked in, you know, how often do we see, because we do a lot of peer consults. We have, you know, you specifically do a lot of peer consults. Yep. I coordinate a lot of peer consultations for people that are in the hospital. So often, I mean, you know, you tell me, I had the other people come back and tell me, you know, when I walked in the room, they were like, why are you here? Why are you talking to me? And then when I showed them that I'm using a prosthesis, they couldn't believe it. Yes. They didn't, you know, it's such an internalized process that you're not realizing that, oh, this person that walked in to talk to me about this, the reason they're doing this is because they have that firsthand experience. Yeah. They've done it. And to instill hope. Right. I mean, you know, because here's like you said, it does take a while, you know, and it's to give them the idea is it's not like when we meet them, they're kind of at one of their lowest points, right? They're trying to process what that's going to be like. And when they visualize us, they're trying to give them an idea what it looks like when they're going to come out on the other side.
Right.
Like there is a life, and I'll be able to, be on the other side and,
Right.
Play with my grandkids or
Right.
run a triathlon or who knows what they want to do. Like we all have, what a quality of life is to every individual is different because we're all different individuals.
Right.
But what that means to every one of us is what makes us what we are.
Right.
And that is equally important to all of us.
And I mean, the hope would be that it starts to kind of quiet some of that noise.
Yes.
So that you can focus on the task at hand, right? And that it's like, okay, this is going to be something that I have to put my determination towards.
Yep.
Like this is what I'm going to do.
Yep.
And I mean, we see it so often, right? I mean, we're in the fortunate position that we get to see people succeed with a prosthesis again and again and again to the level that, I mean, we do talk with a real confidence that, it's not if you get to do these things, it's when you get to do these things.
Right.
Right. So, immediately though, obviously those are all down the road things.
Right.
For this person that's in the hospital right now, where they're in most likely in a high level of pain.
Yes.
Because they just had a very traumatic surgical procedure. They're looking at wound healing. They're looking at, timelines, and they're looking at how do I keep myself as strong as I was before? How can I preserve the things that I had before? And so first of all, I mean, what are things that people are doing for pain control and for, to help with that wound healing?
I mean, just to go back to one of the things that you said too, like that's one of the hardest times is like you talked about, just before getting to when we get that life back, is that waiting for the prosthesis, that be it 8 weeks, 10 weeks, 12 weeks. It just, until we can stand up in the prosthesis, and at that point, at least we're working towards getting our life back, right?
Right.
And then, like you said, the pain and all the other things. But now going back to pain management, right after the surgery, we've got post-surgical pain. We've got phantom limb pain. We've got, swelling, all these other things we're trying to deal with. So that's not fun.
Right.
But and then of course, immediately after the surgery, they, usually they should have nurses and things like that. They'll start to do limb management or pain management. And then you should talk to the nurses. And then when you're discharged, they should have things kind of under control by that point in time.
Right.
You usually won't go home. Most cases you won't go right home. You should go to rehab. But by the time you go to rehab, hopefully, I always tell people it's after the first 2 to 3 days, things should start to settle down. If they're not, they might be looking at some other things just to make sure that, everything's feeling fine and under control.
Yep.
So,
you mentioned going to rehab, and so I mean, one of the things that we see is that like that's pretty disparate for people, right? Like some people really have access to rehab, and some people don't. I mean, I can remember a story of going to a hospital. They called and they said, this person needs a shrinker before they can be discharged. So you drop everything that you're doing, you go up to the hospital, and you go to put the shrinker on, and then, and I'll specifically remember this because this person I helped her put the shrinker on, and the level of pain that she was at was just, through the roof. And, this was early in my career. It was a real eye-opening experience because then I started asking some questions that, her surgery had been 2 hours before that, and she was being discharged to home.
Wow.
2 hours post-amputation.
Okay.
And so, unfortunately, this is another thing where insurances are going to dictate a
True.
lot. Hospital systems are going to dictate a lot.
Yep.
A surgical team. I mean, some surgeons don't put a value in a rehab experience and think, go home, convalesce at home, do those things. And some people don't want to go to rehab. They want to go home.
Yeah.
So those while we really think that rehab is a good controlled environment, one thing about that rehab is that you can get physical therapy every single day.
Right.
It is the best access to physical therapy anybody can get because you can have it every day while you're there, paid for.
Yep.
That doesn't happen at home. That doesn't happen once you're discharged.
No.
Right. And so that's super important. But I mean, if you do go home, what's next? Or even whether you're in rehab or you go home, what's the next step after this? So I've just lost my limb. I've got stitches in it. Maybe the pain is starting to go down. It's manageable now. Now what happens?
Well, just and circling back to the rehab too, like what I tell, because like you said, and it is true. A lot of times people say, and it's understandably so, right? I've just had the surgery. A lot of times too, this is usually, or a lot of times the case. I went to my doctor's office because I've been, say it's my vascular doctor. He's been monitoring this wound. And what I didn't expect was I'm being, admitted to the hospital today because I'm going to have this amputation.
Right.
So my dog's here. I've had this and that. So I had it's like, well, I want to go back home. I don't want to go to rehab. But what I say about rehab is like, they're going to teach you for the first time how to transfer, or how to get up and down the stairs, or, the first time without a leg, it's very important to learn how to maneuver things because your balance is going to be off.
Right.
So they're going to teach you in a controlled environment how you can maneuver around the home safely. Because what we don't want is we don't want any falls.
Right.
Some hospitals may or may not fit you with a protective device. So you protect that limb. If you do have a fall and that suture line is to break open, that's not going to heal the way that it was closed with the suture line.
Right.
That healing process is going to be several months.
Right.
We're talking 4 to 6 months. We're talking neuromas, other things
a lot of times like lifelong complications.
Lifelong complications.
Right.
Yes.
That can't stress enough how important it is to kind of try to cue yourself to protect that limb while it's healing and those things. And one of the times that we see that people frequently fall is in the middle of the night, right? Getting out of bed.
Yeah.
And so it could be as simple as setting up a system where there's a board next to your bed or something, just while you're still not fully conscious and not realizing when your brain is in this fog and not thinking, well, I just had this surgery. I don't have 2 feet to stand on. Unfortunately, that's a story I hear way too often is, I woke up, I went to put my feet down, and then they landed right on the end of my limb.
Yep.
And unfortunately that is often leads to just several complications. So those protective covers can be really important, whether it's a rigid removable dressing or something that helps to prevent something that comes up above your knee that helps to prevent some knee flexion contractures and those things.
Yep.
Probably not a comfortable experience, probably not something that people love to use.
Yep.
But still very important in preserving things.
And you had mentioned like in some extreme cases, people going home like right after the surgery, but it typically, if people stay post-operatively like 3-4 days after surgery, they haven't had time to, like you're saying, get used to that leg not being there. That's not very long.
Right.
The rehab stay is usually about 10 to 14 days. It's a little bit more time to adapt. They've had a little bit more time to experience some of these things where they get trained. So I understand that they don't want to go, they want to go home.
Right.
But being able to experience some of these transferring and get that training firsthand so they don't have to go through it the first time at home and they can be taught how to do it safely.
Right.
To circle back to something that you had mentioned with the post-operative devices and them not, maybe being a little cumbersome. You were talking about pain management.
Right.
And this is something, I do a lot of post-operative devices with the hospitals that I work with. Fitting that shrinker for the first time, that getting that compression on that when they still have the staples in there and the swellings on there. We try to stretch that because we don't want traction on that suture line. That can be painful. But something I tell people, when we get compression on that limb, sometimes these people are in a lot of pain. That really helps reduce a lot of that pain. So I tell them, this may be uncomfortable when I first put it on, but a lot of times I'll follow up an hour after if I have a couple other people to follow up. They're like, oh, you're right. Same thing with the APOPs or the rigid removable dressing. They're like, once you fit them with that, they say, it does feel more comfortable with it on than with it off. Just starting to reduce that swelling sometimes can have as much benefit as pain medicine.
Swelling pain is a real pain.
It is a real
pain. It's a real pain. And maybe that initial feeling of the compression can be pretty uncomfortable or maybe even make it feel like it's more pain, but there's probably a benefit over time.
I'll have people for 3 days, they've been trying to, they're on pain medications and everything else, and then we do the dressing change, we fit them with the shrinker and the APOPs, and they're starting to feel better already. Right. So that's a real thing.
So when do people get a shrinker?
And again, it's going to vary with the doctor. I mean, it's up to the surgeon.
Right.
The surgeon is going to determine, because their number one objective is to make sure that that limb is going to heal. So if they feel the compression is going to interfere with that, so I'm not going to say when.
No,
the doctor is going to determine that. But
that's 100% the right answer.
Yep.
I mean, and some surgeons prefer shrinkers, immediately while there's still stitches in. Some surgeons are more conservative and they want to see the incision site healed before they apply a shrinker. For me personally as a clinician, I've never really noticed a huge benefit either way. It's not one of those things where, oh, my surgeon wants to do it right away, this is a problem, or my surgeon wants to wait, it's a problem. Anecdotally, I've never really noticed a huge difference in people's initial outcomes based on whether they get a shrinker, while there's stitches, or if they wait until the stitches are out. Have you seen a big change in that?
I'll see sometimes there will be doctors that'll say they don't want a compression device on there while they have the staples in, but they have ACE wrap on there.
Right.
So,
Right.
But the big thing with the shrinkers is if they do have ACE wrap on there and they're going home, it's easier for them to manage the shrinker than as opposed to wrapping it correctly.
Right.
Because it can be wrapped incorrectly in a way that they could create trauma to that limb.
Right.
Where the shrinker, if they put it on, the compression is going to be even the way that it should be. And that's the only way that I have I don't want to say a strong opinion, but where I feel that I would prefer a shrinker to ACE wrap.
Right. Oh yeah, of course. I mean, we know that shrinkers are superior to ACE wrap, but I'm just saying that I've never really seen it where somebody was ACE wrapping their limb and then got a shrinker later and it was problematic for them.
No.
So I guess the idea is just to be, with that process, getting the shrinker early isn't going to affect when you get your prosthesis. It's not going to affect things down the road.
No.
Yeah.
If they wait till they get the staples out and we fit the shrinkers, they're
and I mean,
they're typically fine.
We keep using the term shrinker here, but I mean, a shrinker is basically like a compression sock.
Yeah, a compression.
That helps to reduce swelling, and they're made specifically so they put more compression down at the bottom of the limb, and then less compression as it goes up, so that it can kind of push fluid.
Funneling effect.
Has a funneling effect to kind of push the fluid back up into the body, so that the heart can circulate it around, and then hopefully promote some circulation in that limb. So that healing can actually be expedited a little bit.
Yep.
Right? I mean, we've seen that before where maybe there's something a little slow to heal. That shrinker gets put on and all of a sudden now there's room for fresh oxygenated blood down in the residual limb.
And all that fluid pushing the suture line open, that certainly isn't helping.
Right.
Helping to promote healing.
So the person has now the person has their shrinker. When do they expect to get their prosthesis? What's that process look like?
Yeah, I think getting back to you, so they go home, they have the shrinker, or typically probably about 4 to 6 weeks after their discharge from the hospital. Say they go to rehab or they don't go to rehab. Let's say from the time they're discharged from the hospital, they'll go back to see the vascular surgeon. At this point, they're going to be examined to have the staples removed. That's when the vascular surgeon will determine whether they're going to take the staples out or if they need to stay in. They may take every other one out. At that point in time, they may say, follow up with the prosthetist if they feel that the staples are out. They don't usually want them to start weight bearing at that point in time unless maybe they're trauma.
Right.
But they're, have us evaluating for maybe a smaller size shrinker. They might be a couple weeks out from weight bearing, but usually typically 8 to 10 weeks post-operative is about the time that they're, ready for us to start the preparatory prosthetic.
But that really goes back to the surgeon again, doesn't it?
It does,
yes. So, I mean, a lot of these decisions are really based on the discretion of the surgeon, which, I mean, it is the person that has the authority and the expertise to know, They know what's happening, even sometimes even though when the limb looks healed on the inside. I've had surgeons say, no, they're not cleared because they know what's going on. They know, even though it's healed outside, they know what's happening inside the limb, and they just want to see some other level of healing before that process begins.
They could have wounds internally that are tunneling or other things that we're not really qualified to see or infection, things that, we need to make sure that limb is cleared. And healed and healthy and ready to go.
Yep. So that's kind of the process there. I mean, you're looking at realistically, around 8 to 10 weeks post-operative before you really can start. So, just, you kind of alluded to it a little bit, but kind of talk about the emotions during that waiting process, and like, what are some tips and things that you can do during that time to help prepare yourself so that when your surgeon says it's time for a prosthesis, you're maybe emotionally ready. Maybe you can't be emotionally ready,
Yeah.
but as physically ready as possible.
Boy, just try to be as active as you can be and be safe. That it is so important to say. And those almost contradict
That
themselves, don't they?
self-preservation thing,
Yeah,
right?
yes.
Of like, you're really trying to protect yourself.
You need to protect
during
yourself,
this time.
but try to exercise as much as you can. Keep your other 3 limbs active.
Right.
We talk about muscle atrophy of the residual limb, but this is also happening of your other leg, and we talk about contractures of the residual limb, but that can happen of your you're sitting in a wheelchair, so both your hips can contract.
Right.
Right. We need to be active as we can be. If you can use a walker,
Right.
please, use it. It's good for your upper body.
Right.
It's good for, you don't have to necessarily, it doesn't mean you can't use the wheelchair at all.
Right.
But try to get up and move
Right.
when you can.
Or even if you don't feel safe walking with the walker, maybe even just standing.
Right.
In a controlled environment.
In a controlled environment.
Right.
Yes.
Right.
That's why we say do it safely, but it's important to move as much as you can.
Right. And how about seated exercises with your residual limb?
I mean, seated exercises are great, and they're very effective. People might see them and have the idea that they're not as effective, and that is a big misconception. We actually teach them quite a bit, and they're very effective.
And how about, like, we talked a little bit about peer support, but what about like finding someone that's been through a similar experience and kind of relying on them? Do you see a value? I mean, do you see a value in that? I mean, obviously it's going to be personal for everybody, but what's the value in having that maybe mentor?
I mean, I think it's huge. With our Step Up program, we like to credit ourselves a lot and say what a great program that we have.
Right.
But in reality, it's people come back to that because they like it's the mentoring, right?
Right.
They come back to socialize with one another.
Right. See each other's milestones, right?
Yes.
Like it's just something that everybody can celebrate those milestones as a group.
Yeah. I mean, and we have people who are seasoned amputees, and they're there because they like to mentor people, and it's great for the people who are new into the process to see people who are 5-6 years into it, and they're looking at them saying, and they love to hear their stories about when they were 8 weeks or 10 weeks or in their first year, and go, oh wow, like that makes me feel like there's hope for me, because that's what I feel like I'm going through right now, and it normalizes their experience where maybe they feel like they're struggling, and they say, okay, that's normal, and that makes me feel like then I'm having success, where maybe they feel like they're working harder they should have to, because early on coming out of the gates, it's normal to struggle. It doesn't feel natural when you first start walking on the prosthesis, or it is normal to be frustrated while you're waiting to get that first prosthesis. Those feelings that we feel, that's just something we all have to go through.
Right.
And it's nice. And again, I think we mentioned earlier in the process, amputees are less than 1% of the population. So we don't have a lot of people that can relate to those feelings. So to actually be able to talk to someone else, and our family members and the people that they love us and they care about us, it's great that they're there, but they can't necessarily relate to what we're going through. So to talk to someone else that can share that with us, it's nice to be able to have someone to share that experience with.
And so how do you feel like a prosthetist fits into that whole thing? Especially, kind of being, you being someone that has, real close surgical connections, right? Like you have close relationships with surgeons, you work a lot in this realm. How do you feel like you can contribute to surgical planning, rehabilitation, helping people set goals and those things, especially during this period of time?
I mean, I think we're a big part of it. We could talk to people about what they can expect for a realistic time frame, what a realistic timeline is as far as what they can expect for recovery on the prosthesis, what it's going to look like for them to be in the preparatory prosthesis, what the rehab is going to look like. We always talk about the 2-year timeline for what it's going to take for them to maximize on their prosthetic limb. And, the doctor's going to be there for a period of time. The physical therapist is going to be there for a period of time, but the only ones who are really still going to be with them at the end of that 2-year timeline
Right.
are the prosthetists.
Right.
So we're kind of there for the long haul.
So that brings up a great question. How do people know who to go to for a prosthesis? How what's that process look like for somebody?
How do they know who to go to?
Yeah, if they're going to be, set with this person for basically for life, what does this really look like?
I mean, it should be someone that they're comfortable with.
Sure.
A lot of times they would be referred to them by a physician. If you're not comfortable with that person that you're with and the community, and you don't feel like you're questioning what your process is, if you're not getting everything out of that experience, talk, go look online, try to talk to some other people, try to see what their experiences are like.
Right. I mean, do people have to keep that relationship with the person that their physician refers to?
I guess what I'm trying to say is try to see what some of those other experiences are. So you have something else to compare that to. And if you feel that you need to look elsewhere, then that's your choice.
Right.
You don't have to. Ultimately you have the right to decide who you want to work with, and it has to be someone that you're comfortable with. Because here's the thing: when you're working with a prosthesis, it's not a straight line. It's not all black and white. Things are going to change, and there's going to be ups and downs in it. When you're going through those processes, you have to have trust in that process and the person who's making the decisions. So it has to be someone that you're comfortable with. And that's why I kept using the word comfort.
Sure. And I mean, I think it's important to note here that, consultations with a prosthetist are free. Mm-hmm. They don't have a cost to an insurance. They don't have a cost to an individual, right? This is a free service that anybody can do. So, if it's just, there's no barrier there to say, if you feel like I'd say this to my patients all the time. If you feel like you're being held back, or you feel like there's something that's missing from this, I encourage you to go. I'm not challenging them, but I'm encouraging. Go talk to somebody else, get another opinion, hear another voice, and if that voice resonates more with you than the voice that you're hearing, then absolutely that's what you should do, because this is a lifelong relationship.
I mean, internally in our offices, we have had our patients, work with different people just to make sure that they are comfortable.
Absolutely.
And people just relate different with other people and personalities. And it's important that those patients are getting the experience that they need.
Right. And so even though it's a long process while you're getting ready, it's a good time to get to know the person who's going to be giving you some care.
Yes.
There should be some touch points between your initial amputation and when you get your prosthesis. There should be some times that, whether it's while shrinkers are being delivered, whether it's while an evaluation is being performed, those kinds of things, where you should be, interfacing with your prosthetist, right? Like over that time. So it shouldn't be, you have your amputation, then you sit and wait, and then all of a sudden, week 10, you're meeting this person for the first time. Now that happens sometimes.
Yes.
That can happen, but we would think of that as kind of a missed opportunity, right? Like that's...
Well, there's a lot of opportunities to educate, to prepare you for what, like you and I will talk about, if there's a time where you're being fit with the shrinker, and then there's a time where you're going to be fit with the preparatory prosthesis, and then what that experience is going to be like the first time you stand up on it, preparing that individual for what it's going to be like the first time they stand up on that and what to expect is going to have a lot to do with how they're going to react to that the first time they experience that.
Right.
So a lot of the things that we do aren't maybe going to be that, like the fitting with the shrinkers and following up at the doctor's appointments. Maybe it isn't a lot of work as far as from a physical standpoint, but we're doing it because they're interacting, and then them seeing us, we're there to reassure them and to help educate them and to help kind of build their confidence and build that relationship, so that when they, and help prepare them so that when they have that experience, they're like, okay, I kind of knew this was going to be like this. And it's important to kind of prepare them for that moment.
Right. And so, I mean, I'm not sure if you have any other things that you'd like to add about this whole process or this timeline before we kind of wrap this one up. If there's any other kind of final thoughts that you have.
I think with the postoperative care part, I guess just to kind of circle back to the whole thing in the hospital, what I would say is the language and something that we talk about, and I'll go back to saying the amputees being less than 1% of the population, and we talked about the consultations and things like that. If you talk to different people about what to expect, with when somebody's losing a limb, and you talk to 3 different healthcare professionals, a lot of times an individual can get 3 different answers of what what that experience is going to be like, and it can be very confusing to individuals. So we try to use that consultation process to try to give them it's important they get a realistic idea of what an experience on a prosthesis is going to be like, because it is scary. So it's more than just, fitting them with the shrinker and protective devices, which is very important. But again, using that opportunity to try to prepare them for what this experience and this recovery process is going to be like, because it's preparing them for what the rest of their life is going to be like.
Right. And the way I'd like to kind of phrase it is that, you're not alone. And even though you're not doing the things that you want to do, likely, you're not behind. There's not there's not a prescription for how this goes. It's very unique for everybody. So, in those moments of frustration, it's important to kind of internalize and realize that you're not behind.
Yeah.
There's lots of things that you can do, because healing isn't linear.
Yeah.
It's not a straight line process, but with the right team and the right support, you have the ability to move forward. Yep. And you can advance, you can recover, you can do these things. So in this time, it's important to ask questions, expect answers, be involved in your own care, develop those relationships with your surgical team, your rehab team, and your prosthetist, and kind of educate and empower yourself so that once you're cleared to begin using a prosthesis, you're as physically and emotionally prepared as you possibly can be. Mm-hmm. And so that's kind of the way that I'd like to do. And now, so for some of our next episodes, we're going to be going through and describing, a test socket fitting process, and what is a preparatory prosthesis, and what is a definitive prosthesis. And we'll kind of have a series of these things that continue to answer the questions about what does this process look like? What are timelines? What can I expect now that I've had an amputation? So this will kind of be the first episode in that series. And if you have any more questions about postoperative care, or about what to expect right before an amputation, right after an amputation, we'd really encourage you to go to our website, www.bremerprosthetics.com. Check us out on YouTube. Check us out on Facebook. And please feel free to ask questions through any of those. And until then, we'll look forward to seeing you next time.